Hello, my name is Godfrey Palmer and I am a cancer patient. I'm still receiving treatment at Addenbrooke's Hospital, which is ongoing. So first I had an ulcer just at the top of my ear and it was sore and it felt like there was an infection. So I had that for 4 months and I went to my GP to check it out. And they realised actually that needs to be checked out by the hospital. So they sent me to Hinchinbrook and they said we'll need an operation to remove it. And they stitched it up, removed it, seemed fine, it was successful. But a few weeks later, it started to grow significantly here on my neck, and it was getting bigger and bigger and bigger. So we went straight to my GP and they said, no, urgently get to the hospital. So Hinchinbrook then sent me on to Addenbrooke's because it was severe, and they said, yes, we need to treat. And so we continued treatment, going back and forth since then. But I had to keep going back to Addenbrooke's for the treatment, and then they said I needed immunotherapy. So I accepted that, but there were 2 top doctors there who were debating between an operation or going through the treatment. And so we decided it was best for me, for my case, to have the immunotherapy. And so I've been on that since March 2024 until now. So they can text me or email me for my appointments, and I use My Chart, which is an app, so I can access that, which has been good as a deaf person, not to rely on phone calls. This one, it's My Chart, so it's really useful. It's fantastic. It's got all my information there. It tells me my blood tests, my blood group, and my next dates, my appointment dates. It's very, very good to have this. So yeah, I use that regularly. And yeah, back this Friday for the next appointment. So I think the 5th time I had an interpreter with me, sat with me, but we were just twiddling our thumbs because we'd run out of things to talk about because I'm there for an hour in the immunotherapy room. So I said, it's best not to have the interpreter for the immunotherapy sessions. I can know what I'm doing now, and I didn't need to communicate too much with the nurses. I'd already had my chances to ask questions, but now I've had 15 sessions and I've got another one this Friday. So it seems to be going okay. And Wednesday, I've got my blood test and my weight, and I'll have a chat with the consultant to prepare for Friday immunotherapy. Very, very, very fantastic. And it's gone really smoothly, and they book interpreters every time for me, which has been great. So on Friday, for the sessions, I've said I don't need an interpreter, just for those now. When I visit the GP, they hadn't booked interpreters. So sometimes I have to rely on my hearing sister to write things down for me when it's not too serious. But sometimes I have to rely on my family members to come and explain things to me. I think definitely the hospital. It was very, very useful having the interpreters there, but the hospital gave me fantastic treatment. CDA have helped a lot. with the befriending service, sitting with Catherine, but the hospital have helped a lot with treatment and making sure the interpreters are there. So yeah, the hospital have been fab. So when I arrived to begin with, sometimes there weren't interpreters booked, and so they would offer me an iPad, which the hospital already have access to, and they could stand that up in front of me to chat with the interpreter, and that wasn't a problem. Most of the time there's been interpreters there. So yeah, about 7 or 8 months ago, my hip started to become painful as well. And unfortunately, I've had to go to the GP to get advice around that, got an x-ray, and they said, yeah, you definitely do need a replacement. So my additional health needs have made it more difficult getting to and from Addenbrooke's, but hopefully, you know, the replacement's coming soon because it's getting worse and worse, and it means that I can't take my wife with me because I can't push her wheelchair as easily to the appointments. And so I've relied on the befriending scheme, who have been fantastic at supporting. They'll come to us at the car park and they meet me and my wife to help me get to the hospital safely so they can push my wife in the wheelchair. And while I'm actually in treatment, the befriender from CDA will sit with Catherine and they'll go to a cafe and have a chat so I can sit and have my treatment without worrying. And then the befriender stays with Catherine, which has been fantastic. Really, really, really great. No, there's none. Nothing. I had to learn a lot myself. I had to talk to the doctors through the interpreter. I had to catch the information that way, and look up the tablets they gave me, and just piece together bits of information from people around me. So yeah. And when they were talking about whether it was operation or the treatment, I had to take in a lot of that information because I had an interpreter there. So I had to think about what that meant and how to progress with treatment. So you know what it's like, father and son relationship. It might be that the doctor's given some information that's really bad news, and it could have been really frightening and scary for my son to have to pass that along. He knows a lot of the information about it and he's quite confident, obviously, but in early days when you're just getting that diagnosis, it's different. I think having interpreters is the number one thing. The hospital must have interpreters. That's it. Most important thing. Okay, so one thing, it's just about making sure that it's accessible through interpreters. That's number one. And having doctors that are aware of deaf patients. For example, patients might be frightened or they might not know anything about cancer. I had some awareness already, so it wasn't bad. For example, I read English okay, but some deaf people might struggle with all the text that gets sent, so they might need that translated or have an advocacy service to support them. I've got letters up here. I've already got 3 or 4 letters up here.